and prevention of disease to help people live healthier and longer life. She's also a health tech entrepreneur and working in expand the impact of her medicine work in a cost-effective way in various countries across the world using scalable technology including AI, which is a very important thing now. She believes in empowering people, especially women and people with mental health conditions, with evidence-based information to help them make right choice for themselves. I can say definitely, Pooja. I totally believe in all the words you have written here. Thank you so much for joining us on Unity 101.
Thank
So
you.
that's Pooja. And then we have our lead nurse, Donna, GI specialist, nursing and clinical nurse specialist. And thank you, Donna, for joining us. We will be talk more about your specializing and how you can help us when after our last introduction, the men in the room today, because I can see the three women are here, but yes, absolutely you are the special men in the room, and Derek Wadsworth, right?
Yep.
Thank you. I mean, for him, I can say that a cancer survivor. But before this interview started, I spoke to him, and I can say that this is one of the things why he is here. But he's an amazing person. I can say that he was in army. He worked in army for good more than decades, 2 decades actually. And you are a biker too.
Yep.
So there is interesting things we're going to talk about, and of course about your cancer journey, and definitely that's going to be a very different experience because we have specialists who will let us give us information about how we early intervention and how the support NHS can give us, but your experience will be bring us more connection for the people who are survivor or who are right now diagnosed with any cancer. So thank you to three of you to joining us today, and I'm Anjali. So how are we going to start? And it's going to be a very, I know we are in an interview in radio, but it's going to be very informal. We can talk about whatever the journey, whatever the experience you have come across for cancer, so our listeners can connect straight away from all of you. So my first question, I can go with you, Pooja. Why is cancer awareness important for all South Asian community in the UK? I know it's important for everyone, but we'll focus on South Asian community because that's what we would like to catch. A lot of people still not going out and talk about it.
Sure. Thank you. Thank you, Anjali. And thanks to Unity 101 for inviting me. I think cancer awareness is important because early detection can save lives. And different communities have different barriers to seeking help about cancer. It could be cultural barriers, it could be language barriers. Some people are new to the country and they are not aware of the health services, but that often ends in them presenting to the clinicians quite late. And then that sadly results in poorer outcomes of the cancer. Yeah. Mm-hmm. We live in a society now where thankfully science and technology has helped us get great outcomes for even in cancer. Mm-hmm. And I think that's why thanks to such events and where we can create more awareness so people can seek early help, go for screening programs, and as a result hopefully we'll beat the cancer.
Yeah, absolutely. And I think GP is always the first door when anything happen in our body, either it's cancer or anything. So I think it's very important if you give them a right direction.
Absolutely.
So that, thank you so much. I'll straight go to Donna and then I'll come back to Derek because I have very interesting question for you related to this one. What's your take on this? Because you being a nurse, you have been experienced many different diverse people, or anyone can come for the early intervention. But how's your experience working with South Asian community? Did you feel any different?
Sure. Yeah, I think my experience is that actually probably people from the South Asian community are often a little bit more anxious about coming forward and are concerned that possibly, understanding of cultural differences may be less than they would like, and often I think embarrassment about talking about sometimes very sensitive areas of the body is a real thing. And, you know, to reassure people, we are always more than willing to accommodate any needs or anxiety, whether that be trying to get someone from the same community. Certainly my team, I have a very experienced nurse specialist, Rajni, who, you know, particularly is great when people's maybe understanding of English isn't as good. But certainly one thing that we've always said is no matter how embarrassing someone may feel their symptoms are or their problems are, dying from embarrassment is not necessary.
Absolutely.
And the one thing I can promise is that everybody will be treated with respect and sensitivity.
That's really good. Thank you very much. Actually, I agree with you. Sometime what the society will talk, this is very, very much in our community. And I think you said embarrassment is not the reason not to come and talk about it. So thank you for sharing it. So I'll come back to you, Derek, now. We are talking about definitely important about talking in South Asian community. But indeed, you have gone through this situation. So how was your early intervention? Well, you knew that very early about your cancer. What was your journey in the early stage? How was it?
Well, I was very lucky because I got through because of my age, I got through the post, the little fit test, or what's commonly known as the poo stick.
Yeah, okay.
And I'd sent that off a couple of times before.
Okay.
And they'd come back negative.
Okay.
And I got it through the post again, as normal. Did the poo test, sent it off, and within a week, I was in Winchester Hospital having a colonoscopy.
Oh, okay.
Because they found something. Mm-hmm. I had no symptoms whatsoever.
Right.
And within 7 weeks, they found the tumour, and within 7 weeks I was in hospital having it operated on. But because they got it so early, when they operated on it, they managed to get it all the first go.
Right.
And I didn't have to have any chemotherapy. I didn't have to have any radiotherapy, purely because they'd found it so early.
So early,
But
right.
as I say, the important thing was that I hadn't got any symptoms whatsoever. I had
Right.
no inclination until I got the letter through from the fit test saying, report to the hospital.
Right. I think after listening him, Pooja and Donna, correct me if I'm wrong here, but I think it's absolutely because you've been doing this regular fitting test about your body, about your health.
Yeah.
That is very important because generally we as a human, we always think, okay, we'll do it some other time. So what's your take? Because Derek is a real example for all of us. So what's your take on this, Pooja? Because being a GP, I think it's very important you put everyone in this pressure. Do your health check now.
Absolutely. No, I can't agree. And thank you so much, Derek, for sharing your story. I think you've hopefully motivated a lot of our listeners to go for the screening test. So in the UK, we are very lucky to have excellent screening programs for a range of cancers. So it is bowel cancer, it is cervical cancer, it is breast cancer, and everybody will get invitation to these screening tests at their home address, really. And I would strongly encourage everyone to attend these. If you have any questions about what it entails, what you need to do, will it be painful, things like that, chat with us. You can always discuss. You can find information on NHS website. If you're worried about whether you will be able to communicate properly, you can always request a language line, so translators can help you with that. In most of these places, you're allowed to take a trusted family member if you feel that support is needed, or a friend or somebody. They can be there. And these days, I think most of the NHS professionals are trained, and they're very sensitive about cultural differences, and they're very supportive. So I think these tests are for people who are not symptomatic. So I want to stress that if someone's getting any symptoms, or if there are a range of symptoms depending on what body part we're talking about, but say we are talking about breast, if someone finds a lump, then they shouldn't, of course, wait for the screening test and immediately seek help and go to your GP and get it checked. But these tests are for very early detection in people who are asymptomatic. And so, yes, definitely encourage everyone to attend all the screening tests.
Screening, yeah, is very important.
But to that end, I always encourage all of my friends and people I know
Yeah.
to actually do it. And, sometimes they say, oh, it's a bit embarrassing. And I say, well, it's not really, because you're doing it in the privacy of your own bathroom. There's nobody
Yeah.
else there.
I know. Yeah.
Do it, because it can save your life.
Yeah, absolutely. And I think it's just like what is important for us and the timing. And now the days where we are running, time is less and we have so much to do in life.
Yeah.
So that's a very important message. And I mean, we have a next question, Donna, and I will say that I'll ask you as there are very common risk factor, which is there, especially in the cancer, situation. And what you suggest for us, especially to everyone, not only in South Asian community, anyone who will be aware of about the cancer?
So I think it very much depends on which cancer you're talking to, or talking about rather. So, for instance, breast cancer, clearly finding any lump, whether that be a lump in the breast or under the arm, is really important to report to your GP and get that looked at. With gut-related cancers, which are my specialty, from the top of the gut in the esophagus right the way down through to the bowel, any changes really, so changes in bowel habit, noticing blood in the poo, noticing blood in your urine, particularly swallowing problems. We're seeing a big increase in esophagus and stomach cancers. And certainly, difficulties in swallowing. Indigestion is something that everyone thinks is normal. I've just had something that's too spicy. I've eaten something too quickly. Those things really need to be reported if they're persistent. So if you've got a symptom that's new for you and actually is going on for more than a week, getting worse, report it to your doctor. As healthcare professionals, we would much rather see 1,000 people and save one life than only see 10 people and, be dealing with problems later on that are either not possible to cure or actually much more difficult to cure.
Well, after listening all three of you, I can say that I think first, we are our first doctor actually. Isn't it? I'm saying right? Because I think
totally.
we need to understand what our body is. Then only we can go to the specialist like you. And then, like Derek said, he was just doing normal test, and he diagnosed with this. But Derek, this question is in my mind after talking to you is, you said yes, because you had an early intervention, so your journey was not that tough with someone who has gone through chemotherapy or some other treatment for cancer problem. But how was yours? Because how long it take you to come out, and was there any kind of, what was your emotional journey with your family member? Because the C word is a very dangerous word in the world of health itself. So what was your journey during that time when the treatments was going on? I think the listener would like to know about that.
Yeah, it's a bit of a shock to start with. But I'm saying I'm fortunate because of the way I've lived my life with the army and everything else. You tend to, when you find something like that, your immediate action is, right, let's get it sorted and crack on with life, And that basically is I found it was the easiest way to deal with it. I have a sister who had cancer as well.
Okay.
And she had to have a hysterectomy because of it. And she's of the same sort of ilk. She just gets on with life, and she doesn't let things get her down because of it. And I'm very much the same. You've all right, you've got it. You've got to deal with it, but it's no good sitting in the corner and crying your eyes out.
Yeah.
You've got to get on with your life,
Yeah, and how was the support within NHS? I mean, with the journey of the doctors test and everything? Because I know you've been diagnosed early, but how was the journey after that, getting appointment?
I cannot fault Winchester Hospital, which was where I had my treatment.
Sure.
They were fantastic. And the cancer nurses, because I had to have a stoma bag for about 5-6 months, the stoma nurses were very, very supportive. The doctors were very supportive. The nurses were very supportive. It was brilliant. And since then, I've had checkups as well, and very helpful.
Very helpful.
They're very,
the follow-ups.
very, very good. The follow-up.
Okay, great. So good to hear, actually. Good to hear about when we listen, especially from the department who's handling the cancer, problems and this difficult time with the patient. So thank you, Derek. I think it's very important to listeners to know, because half of the people I met who have any problem, forget about cancer, the first thing is the blame to the NHS. Do you agree? So I think we are in the right place to talk. It's not NHS. It's like you need to start and they will support you. And I can say that very, very proudly on this, because I feel like whenever I need a support from NHS for any health issues, I find it very easily.
Great.
Yeah. So that's why I think it's good to know for the cancer treatment also, doctors are there, nurses are there. And if you're in the right place and the signposting, if happen in the right side, that is very important.
Absolutely.
Because in this technology world where ChatGPT become our doctor, I mean, seriously, I have seen people who are talking to ChatGPT every day about their problems. What you two specialists will say, I mean, for signposting, is there any way which can be done in GP for early intervention or anything if somebody is going on? Because I feel it's not only about to give the medicine and the treatment. When you have a cancer, and Derek, maybe you will relate on this, if family members, everyone, well-being, mental health, everything is very important.
Absolutely.
So how you will say, Donna, if I ask you, like, what your take in this, if somebody is the signposting is in your department when the patient is coming, how you're giving them other information apart from that particular?
Sure. So certainly anyone who's diagnosed with a cancer, whether that be in Southampton or like Derek in Winchester and the other hospitals locally, they will all be assigned a clinical nurse specialist who is a nurse who specialises in that type of cancer, can give them information about the cancer treatment, support for them, support for their family, and also signposting to other local services. So we're very lucky in Southampton. We have something called the Maggie's Centre, which is a cancer support centre that's up in the car park effectively at Southampton General. And they're an independent charity who provide a lot of support for different types of cancer, equally for men who often deal with their cancer in a different way than women do, because men, this is a sweeping generalisation, often don't talk as openly about their feelings as women can do. And we can also signpost. We've got cancer support workers who will help us signpost people to specialist services, whether that be speciality because of their ethnicity and culture or their religion. And if we don't know something, we will always be able to find someone that can help us find the answer. But certainly speaking to the team, talking about what you're worried about. I always tell my patients there's no such thing as a silly question. And if you don't know the answer to a question, it's because we haven't told you, so it's our fault and not yours. So just tell me what you're worried about, and if I don't know the answer, I will find out. And cancer treatment has changed and improved so much it's nearly 30 bless you, 39 years I've been working at Southampton General. Cancer treatment has evolved, and I think the fear is that cancer is one word that describes several hundred different diseases.
Yeah.
And they're not all the same, and Dr. Google can be useful, but Dr. Google can also be very terrifying.
Absolutely.
And a lot of what you read may never affect you.
Yeah. I know. I mean, it's very important. As you said, Dr. Google is not good, but now it's not only Google, it's so many other platform.
Absolutely.
You know, keep, and I don't know, you believe in this or not, but this is very true. If you think about something, suddenly those questions are coming up on your different social media sites.
Yeah.
So as a GP, I want to know from you, Pooja, when somebody comes to you for discussing about the cancer issue or anything which they feel like, what will be your first suggestion to them? Of course, you will signpost them and give them information to go. But from this point of view, how your suggestion will be?
That's an interesting question, Anjali. I think what I would suggest is main thing is to notice any change happening in your body. So anything new. It could be a non-healing ulcer. It could be persistent change in bowel habits. It could be a new onset cough which is not settling. It could be new onset bloating which is not settling. So a lot of different things can be early signs of cancer. But then if that happens, then go on reliable websites. If they want to read something about those symptoms, go on NHS websites. That's the most reliable one. And then if these symptoms are persistent, please book an appointment with the GP. I understand it's not sometimes easy to book, but when they put in a request, if they say that these things are happening and I'm worried about cancer, if they even mention it, then at least the clinician who is triaging will know, okay, these are the things, this is what the patient is concerned about. And they will look at the overall history, medications, and then understand the concerns and hopefully address those. And probably give the appointment based on the concerns.
Yeah.
So sometimes if somebody says, I've got this back pain, but then they don't say what they're concerned about, then it can be just directed to a physiotherapist. And if there are any other symptoms with it, is there a weight loss or anything else happening with that? So the better history along with the duration of symptoms patients give us, it really helps the clinicians triage it and give them appropriate appointment. And definitely don't rely on WhatsApp forwards and reels to confirm the diagnosis or think about the diagnosis.
And a lot of home remedies at home.
Yes, that's another thing really. So I think it's also the lifestyle, isn't it? So
absolutely. Yeah. So I mean, straight to direct now, because I have another question in my mind which relates to this because of your journey. I know it's different because you have early intervention and the treatment was good, hospital was good, everything was going good. But during that time when you're at home, as Pooja just mentioned about your lifestyle, so have you done anything different to when you definitely medicines there, treatment there? So anything you wanted to tell our listeners, what can help them more to get fix your problem?
Well, the only real thing you have to do is find out with your diet. You've got to decide what is going to aggravate what you've already got. So you have to do trial and error on what you can and can't eat. Obviously, just to put it into basic terms, where they removed part of my bowel, they've reduced my storage space, so to speak.
Okay.
So you have to be aware that you're going to be going to the toilet more regularly.
Okay.
Because you haven't got the storage space anymore.
Yeah, absolutely.
To put it into basic layman's terms,
Right.
So you have to be aware of where you are when you go anywhere. You need to just double check to see where the toilets are and little things like that.
Logistics. Yeah.
But it's nothing really drastic.
Yeah.
All the rest of my lifestyle is pretty much the same as it was before.
I think this is one. Yeah. Did I want to say something in this? Yeah.
Sorry, Derek. I was just going to add to that, as well as diet, one thing that we've got a lot of research evidence about now is the importance of improving your fitness. And we know that before any surgery, improving fitness is really important, but actually now increasingly we're also using exercise programs for people who are having chemo and radiotherapy as well, because those treatments actually become more successful and the side effects are less if you are more physically active. And that doesn't mean necessarily going into the gym, although some people can access free gym if they want to. Some of it can just be going for a walk, getting out of breath, using a static bike at home. Those things are really very important for anybody having cancer treatments, but also in life generally, you know, women to improve their bone health.
Absolutely.
Lots of things.
I'm going to add something to that if it's all right. Thank you. Thank you both for highlighting these things. And I think lifestyle can definitely reduce risk of many, many cancers. And as Donna and Derek said, definitely healthier lifestyle in terms of regular exercise, healthier diet. We are getting more and more evidence these days about processed food and risks around that. So that's something definitely we should avoid. We should tell our children to avoid that as well, and help them learn to cook more and more at home. And at the same time, we definitely know tobacco, whether it's smoking or oral tobacco, which is sometimes higher in South Asian communities. And often we see a lot of advice about smoking in NHS, but in some areas this advice is missed because Asian communities might be in minority, but oral tobacco also significantly increases risk.
Can you please explain?
Yeah, oral tobacco is gutka, jarda, tobacco in pan masala, and things like that.
These are Indian brands, which Indian people and Asian people eat a lot. It's like a...
So a lot of people have habit of chewing these, and they cause a lot of irritation, and they can cause oral cancer, esophageal cancer, and that again increases risk, especially if it's had with alcohol. So that increases risk. Smoking with alcohol increases risk of all these esophageal and oral cancer. And also now we have screening program in Southampton. We are lucky to have that. It's not available everywhere in the UK. But in Southampton, we have screening for lung cancer in people who are smokers. So that's something, again, some people might get invite for that, and I would strongly encourage them to attend that as well.
Wow, that's really interesting to know, because I'm going to work soon for a smoke-free Southampton.
Fantastic.
So that's another project we are working on. So this is also very important. But thank you, Pooja. I think that's really important. And while talking to you, three of you, there is another question. I mean, that's the way my question comes. When you were asking there is any question, my come when I sit on this table and start talking to the specialist people. Actually, there is one more thing. We were just sitting on one of our friend house, and we were talking about different medicine, different things. Nowadays, way-reduced medicines are there, everything. And especially the children with the special need, because Pooja, my daughter is having a special need, and she's on ADHD medication. And there was a discussion where we start talking about these medications or any other medication, like for type 2 diabetes also nowadays, because of PCOS, so all these things, then type 2 medicines are also there. But then somebody start talking, because they said there's a data found these medicine also can give a cancer.
Well, I think what we should, trust the clinicians who are trained in it. Normally, things that are available in NHS, the evidence has been looked at, and then the guidelines are there, which again are done after quite a lot of deliberation, looking at risk and benefit. Every medicine will have some risks.
Absolutely.
So I think trained clinicians will usually discuss the pros and cons of starting any long-term medication. I wouldn't think that if any medicine is known to would definitely give cancer that would be used in
Yeah.
people regularly, at least in the NHS. So I think I wouldn't say that someone should say no to medicine just because they've heard from somewhere that it
Yes.
causes cancer. But if you have concerns, or if anybody has concerns, they can definitely discuss with the specialist who started the therapy, and they will then discuss pros and cons of every medicine the person is on.
Great. I mean, it's very important, yes, but yes, the myths
I know the myth
myth
busting is really
is
really
very important in any community. Think about it, it's not only South Asian, in any community.
True.
So I have one question for you and one for you, Donna, now. It's the same medicine thing, because being a nurse, I mean, obviously, I don't know you prescribe the medication, because I know GP does, you do that.
I do that
So
as well.
because some of the patients might come up with some multiple health issues, like they have a cancer issues, I know, but there is something else is going on in their health life. So being a nurse, when you need to prescribe the medication, so is there any way which you need to say that, okay, you need to stop this now because you're taking this medication? Because this question somebody sent me on Facebook, actually. I'm having this XYZ problem, and I think I'm not sure, but I think I have a cancer. So will I stop eating that medicine? So what do your answer will be?
Sometimes we start new medications that we do have to stop existing meds for. Particularly chemotherapy treatments. There are some medicines, particularly actually some kind of herbal medicines and some types of vitamins and minerals that we actually recommend people do stop, because that can interact with the chemotherapy drugs.
Very important.
So we do often ask people what they're taking, both prescribed and over-the-counter or herbal remedies.
Right.
But generally, the person prescribing will, we have access to something called the BNF, which is the formulary book, which tells you if there are interactions. And if we're not sure and people are on lots of medications, we can speak to the pharmacists and they will run through everything with us.
That's good. And that's very important to know, because I think this is one question which maybe people will be having in mind, but they wouldn't have a right time to talk to right people. So I think this answer will be definitely help them. And now direct to you, because of when you have this process going on for your treatment. So is there any kind of difficulty with the medication which you were having it? Because obviously ibuprofen give a stomach pain, constipation and different, because your body is taking so many medication, things in your body. So what was your health-wise? I know you're a healthy man, but still.
I'm very lucky, actually. At the moment, I only take 2 tablets. I take a statin and I take a calcium tablet. And that's the only medication I have to take.
Oh, great.
I mean, I've got friends of my age who, when they take that medication, much medication, that when they walk, they rattle. But I'm very, very fortunate in that that aspect. So I don't get that real problem.
Right.
The only thing I really have to take every now and again is a bit of Imodium every now and again, or occasionally I get a little bit of stomach upset, so I take a couple of Rennies. But that's all I have to take, which is
quite good.
I'm quite fortunate in that.
Fortunate in that, yeah.
In that aspect.
I can say that. I mean, Derek, you're a right guest today, because what is main topic today, or in this cancer awareness, is the main thing which we are forced to saying people: early intervention.
Absolutely.
If you have that, then of course your journey, if you have a cancer, your journey can be like Derek. So I think you don't have to think of difficult chemotherapy if you keep checking yourself, and it will save a lot of money of NHS, of course, but definitely your stress level. So on that note, I'm going to say once again, because we are halfway, all the listeners today who are with us, I'm your presenter Anjali, and we are on our community hours for Unity for Cancer. And we have our 3 guests today, Dr. Pooja Kirpeker GP, who has been talking a lot of important information. If you're thinking your body is giving you a signal of something which is not right, early intervention is very good. What medicine we should have and we should not have. We have Donna, the nurse from our specialist nursing and clinical nurse specialist who's sharing a lot of important information about how the difficulty in the South Asian community and how we can talk more and signpost different things, right website to information. These two specialists from medical line there, but we have our guest, Derek, who is sharing his own journey when he diagnosed with very early cancer, and now he's healthy and he can go for a bike again, I think, soon. So welcome back. Yes, and if you have any questions about this community hour, you can drop a message to us, or you can call us later, 0238 023 5055, or drop a message on our WhatsApp 07759 796 or drop an email to us also. Plus, you can see this community hour on our YouTube channel of unity101.org. Plus, I'm here. If you want to talk to me, I can signpost you the right information. So welcome back once again after the break. I think we have only a few minutes left now to finish our community hour for this. But thank you to all three of you. So I think we have covered mostly all the areas. So I will ask one question from, maybe start with you. We had talked about screening. We had talked about everything. Are there any resource of support groups, especially for South Asian affected by cancer? I know you said Maggie is there, but there anything, Pooja, you would like to highlight?
I think if hospital, depending on which cancer, if someone's got any, they will direct them to the right team. We have Wessex Cancer Alliance in the area, which is specialist, but Macmillan nurses do a fantastic job as well. I think there are services which can help in getting financial support if that's needed, any kind of benefits. If there is a single parent, then there can be support to children. So specialist counseling is available in that case. And same, I think many of the religious places provide support as well. So they can provide community and friends and family. So cancer is not something people should consider as a taboo. It's not something to be ashamed of, definitely. Cancer doesn't discriminate. It can happen to anybody.
Yeah.
And I think it's really important, if at all someone gets it, then seek early help, and then talk about it. Once we talk about it, lot of people who have actually had cancer, they say that, oh, I didn't know so many people around me have had it as well. People just don't talk about it.
Absolutely.
And sometimes if you talk to someone who's gone through that, just sharing concerns can be a very stress relieving thing sometimes.
It is indeed. And I think within our Asian community, I think what I have observed, Pooja, is some people feel like, okay, if we are going and talk about our problem, especially for cancer, so people will think we are taking sympathy. So this is also one mindset is there. And yes, you deserve this sympathy. You deserve empathy. Please don't mind. Come and talk about it. Don't think about that. So on that note, Donna, another question from you. And I think, Derek, you also just mentioned your sister also had cancer. So on that, I want to know, this is another myth actually, but it is true also. I don't know what the data says. It's very much is their mind in the family. If one person in the family has a cancer, it will be happen to everyone. And that scare, that fear, I can see the people I talk, because my mom had, my dad had, my uncle had, my sister had. So now I'm in very high risk.
Yeah.
Is it right?
So all cancers are different, essentially, and we are now very fortunate that we can test individual people and their cancers to look for genetic links.
Yes.
And, there are some which are very much genetic. Certainly breast cancer, ovarian cancer can run in families. There is something called Lynch syndrome, which can make you more susceptible to cancer. And we can actually now test for those. We've got clinical geneticists who can help us with that. But certainly, all cancers do not run in families at all. And we've had some patients who have had, incredibly big families locally here in Southampton, who it's a one-off random piece of bad luck.
Okay. Right. So it's a myth then.
it's mixed. So
It's mixed,
it's
yeah.
a bit of a myth, but there is also some science behind it that says for some people, that is true. But
True, yeah.
when we know about it, we can then put in extra screening for those people's families
Of course.
to get their cancer early, like Derek's was. And we know that
Mm.
if we get cancers early, the chances of curing them are so much
So
higher.
much high. Yeah, absolutely. But thank you. I think this question was there in my mind from a long time. So thank you so much. Now, Derek, you just mentioned your sister also has cancer. So is it genetic? That's why you...
No, it's
No?
totally different type of cancer
Mm-hmm.
but for both of us. It was just a case of two of us got it, but a different type of cancer.
Sure.
Yeah.
Okay. So, I mean, that's what we wanted to say, our listeners. Yes, it can be a genetic, but that doesn't mean if somebody has in your family, you will be also getting, because I think they get mixed with a heart attack or some other problem. They said, oh, my mother had that, so I will have this. Because I get very confused because my mother had a breast cancer back in India when I was in like 1997.
Okay.
So, and like you, Derek, she's 75 now and healthy because she got diagnosed like in a week time because she got pus. And then, of course, after that, we just immediately went to doc at that time. And things happened in a month. She got operated. Everything is done and it's gone.
Yeah.
So, yeah. So, and that's what I always, when this project was coming in my hand, I was like, I'm a living example of this because my mom was like that. And now everybody said, you keep checking your breast because you might have a breast cancer. I said, okay, it's a good idea to go and check about it, but that doesn't mean I have it.
Absolutely.
And
Very small percentage of cancers are of genetic. And if that is the case, then yes, as Donna said, the family will be screened more often and things like that. But just because someone in the family has got it doesn't mean everyone else is going to get it. And of course, they should still attend routine screening and self-checking if it's for breasts and things, but not get paranoid about it.
Yeah, we should not be. I think definitely we should just go with the right channel, right people, and then take the decision rather than just thinking and reading about it on Instagram.
Absolutely.
Good. I think,
Well, the only other thing I would like to say
yeah,
is, and it sounds a little bit dramatic,
go for it.
but a lot of people I've spoken to have turned around and said, oh, you've got cancer, you're going to die.
Yeah.
And I'm living proof that just because you've got cancer, it doesn't mean it's not a death sentence.
Absolutely.
I've now been clear for nearly 5 years. And just because you get it doesn't mean you've got to give up. you know.
Yes, absolutely.
If you keep going, it doesn't. I'm living proof that it doesn't kill
It is.
if it gets treated early enough.
Yeah, I think that's why we want the patients like you and the people like you to come and talk about it. It's very important to motivate people because half of the time, and I'm telling you, Pooja, recently, I mean, you know, Bournemouth Dorset, I work very closely there also. It's a very, very difficult time for one of our family friend. The lady, she was just 52 and she was going through a lot of pain in her tummy, stomach, and she's 52 and things was going, she's in menopause. She's in perimenopause. So the tummy pain is happening because of that reason. She was just neglecting because busy with children, 3 boys and everything. And then one day she literally collapsed because of the pain in the tummy, and then ambulance came, took her. She was on stage for lung cancer.
Oh, sorry to hear.
And we were shocked when we got to know, and within a week she's gone. And how she gone? Because of heart attack, 2 stroke, because she couldn't take it. She has lung cancer because she was so healthy. She never had any headaches. She never had anything, and suddenly this has happened. It was such a sad news for all the community. She was such a bubbly girl and into food catering and everything. And the reason I'm saying this story is we women, especially Pooja, Donna, you understand, after 40, we get so many different hormones problem in our body. And we keep thinking it is because of that this pain is happening. So what your both I know, Derek, maybe this question not related to you. I will end. This is my last question for today, and then we'll wrap up. What's your take on this, especially for the women with a 40 plus age, because of they have different hormones change in their body? What message you want to give them for their treatment? Maybe it may be a cancer.
Yeah, again, we don't want anyone to get paranoid. But I would suggest that rather than diagnosing something yourself, if you notice any change in your body in terms of, could be anything. We said some of the things earlier, could be persistent bleeding, could be any lump definitely, or non-healing ulcer, new tummy pain, which is not going, then they should just report it to their GP and not say, oh, I've got this pain because of menopause and can I have HRT? Because then they have diagnosed it, and then the clinician is also thinking about, okay, maybe they just want a HRT.
Yeah.
While if they present saying that I have got this tummy pain and I don't know what it is coming from, then it will be investigated.
Yeah, but just one thing. I know you said that, but half of the people think when we are going to GP talking about these things, most of the time they said, "Oh, you're 40 now. It's just definitely a perimenopause or menopause. So change your lifestyle, do this." So I'm just saying, GP is here, Pooja. She's Dr. Pooja saying you can talk about it in detail, but tell in detail to the GP so they will give you right signposting for diagnosing an early test. So you will
Giving
be
good history definitely
Yes.
helps the clinicians
Of course.
with duration, exact symptoms, and that will help.
Absolutely. Donna, your take on this?
I would echo what Pooja said. Never assume that something is one thing.
Yeah.
It may be related to menopause. It equally might not be. And we would much rather, as healthcare professionals, be able to reassure someone that they don't have a cancer than be, consoling them and their family when they've got a cancer that's very advanced. And I think as mothers, we do run around after our children. And it's easy to think, well, the family need me too much for me to go and look after me. But actually, if you don't report something and it is a cancer, you may not be there to look after your family.
Absolutely, I agree.
So by looking after you, you're looking after them.
Oh, yeah, I agree. I totally agree on that. On this note, I think I'll start with Derek. What do you want to give a last message to our listeners, and how was your experience? Anything special you want to tell all our listeners today?
Well, with my cancer in particular, I encourage people when they get the fit test through the post, do it. Do it and send it back.
Right.
If it's nothing, then that's fine.
Yeah.
If there is something there, they can find it early. And if
Yes.
they can find it early, there's a much better chance of them getting rid of it for you.
Great. So early intervention, we
Yeah.
have living example. So please listen to Derek. Pooja, any message last for our listener, please?
Yeah, just building on Derek's thing, definitely attend all screening tests. Make sure your children get HPV vaccines. We haven't gone into details of that, but that's again to prevent future cervical cancer.
Okay.
If you have any concerns, speak to the clinicians and make healthier lifestyle choices before it's too late.
Too late, yeah. I think HPV
Vaccine.
yes.
It is given in schools.
Okay.
It is part of national programs. All children will be offered that between the age of 12 and 13. And the school nurses give that. So just make sure you give consent when you get that form. It is for boys and girls, so that boys don't carry it and pass it to girls in
Girls, yeah.
future.
Okay.
But it is to prevent and significantly 99% of cervical cancers are due to HPV. So the vaccine would almost eradicate cervical cancer in future.
Wow. I have
Fingers
no
crossed.
idea. I don't know. I need to check my daughter had or not. Any last message, Donna, from you?
It would be from me, please come forward. Don't assume that everything's fine. Don't assume that new symptoms are normal and put them down to other problems. We would much rather see lots of people and reassure them than miss one cancer.
Yes. Thank you so much to all three of you. And I think it's really important what we discussed today. And I hope if at least one or two people also listen today and carry forward this information to other two people, it will be a great initiative from our side. So thank you, everyone. Have a
Thank
nice
you.
time ahead, and I hope we'll be in touch to get more signposting and give information to our community. Thank you, Pooja. Thank you, Dorek, and thank you, Donna. And thank you to everyone who are listening us. If you missed out, you can take up on our YouTube channel. We have this recording going to be soon, and or of course you can listen again audio on our website. Take care, goodbye, and Shabba khair.